Arthrofibrosis, physical therapy. This video gives information about physical therapy for arthrofibrosis following knee replacement. Most physicians consider physical therapy as the first step in treating arthrofibrosis following knee replacement. Physical therapy could be considered within the first 6 weeks after the knee replacement. The timing and the intensity of physical therapy for arthrofibrosis is a bit controversial. Many physicians consider immediate and aggressive physical therapy for arthrofibrosis following knee replacement. On the other hand, for arthrofibrosis following arthroscopic knee surgeries, many surgeons suggest gentle physical therapy after the pain and inflammation subside. They suggest physical therapy without much force within the pain-free range. Adequate pain control is extremely important for successful physical therapy. Modern multimodal pain management is very effective. Additionally, mechanical stretching devices like flexinator and extensionator can be used to improve motion. Continuous passive motion is less effective for stiffness. Static and dynamic progressive extension splints or braces are also helpful for flexion contraction.